Hello and welcome to the 2020 CanForum. I'm Richard Vines from the National Oncology Alliance, and this year I'm pleased to bring you the first of three very special programs on Australians and cancer. While cancer is a word we all fear, this series will bring you hope. Hope that if we play our cards right, if we start making changes now, then Australia's cancer survival rates will skyrocket by the year 2030. You may think Australia is doing pretty well already, and the fact is we do have one of the highest survival rates in the world. But the tragedy is these survival rates do not extend to all cancer types, and that's simply not good enough. If we do nothing, more than 50,000 Australians, adults and children, will die from cancer every year between now and 2030. But if we move now, we can save tens, even hundreds of thousands of Australian lives over the next decade. And that's a vision worth fighting for. So please settle in and prepare to get really excited by the opportunities that are coming our way to save more lives from cancer.
Hi, my name is Emma Capell. I had a skull-based chondrosarcoma tumour in my head. And for treatment, I got to wear Daisy here.
In 2017, a tumour the size of Emma's thumb was found in her skull.
That's where the tumour was, smack in the middle of my head, a very tricky spot to get to.
Though he had very little experience treating this rare cancer, Emma's doctor proposed standard radiation therapy. But when Emma found other chondrosarcoma patients via Facebook, they were talking about another treatment.
Without fail, proton. Everybody had proton therapy. So I'm like, okay, so that's what I need then.
Today is National Cancer Survivors Day, and we're about to share a story with you of a woman who traveled halfway around the world for treatment here in Maryland.
With no proton beam therapy machine in Australia, Emma spent 3 months in the American city of Baltimore undergoing 35 treatments.
So the proton radiation comes into the exact spot, and it's accurate within millimetres and delivers a very precise and high dosage to the area you need with no exit point, with no exit damage. Some people would come from work, get the treatment, go back to work, the radiation vacation. It was, in terms of treatment, it was the lottery of treatments. You know, you go there, everyone's so caring. They zap you like, oh, okay, done. I'm like, bye, everybody.
3 years on, and Emma considers herself cured.
I am. To me, I am. Cancer is so 2017, all behind me. I'm done. I'm good.
But it still astonishes her that such a precise, effective and easy-on-the-body treatment isn't available in Australia.
I saw 9 specialists. Nobody was talking about proton. Nobody was saying this is what you need and this is how you get it.
Australia's first proton beam therapy unit should be operational by 2024. Expensive to build, but able to see up to 700 patients a year with difficult-to-treat cancers.
Radiation therapy in general, not only proton beam therapy, is underutilised within Australia. It has a low profile, but the benefits are really high. Hello, I'm Amanda Ruth. I'm the Head of Policy and Public Affairs at Rare Cancers Australia, and I'm heavily involved in the National Oncology Alliance and the author of Vision 2030.
Vision 2030 is the culmination of a year's work. In it, 400 cancer experts analyse the latest therapies and emerging technologies.
To look at the systemic frameworks that really underpin the healthcare system and make sure that we're ready. Can the systems cope with evaluating these new therapies and technologies so that patients can access them as they need to and when they need to?
Hi everyone, I'm Alison.
3 years ago, Alison Bolton, a regular triathlete, heard rasping in her chest while running. She was diagnosed with a rare lung cancer and endured traditional radiation and chemotherapy for months.
I had trouble eating because the radiation had burned my esophagus. It was so painful, and I was miserable. I couldn't do anything more than sit on the couch. It was just a really rough time.
The treatment killed the lung cancer, but not before it had spread to Alison's brain, leg and kidney. Thankfully, genetic sequencing of her original cancer revealed it had a specific gene mutation, a mutation that, luckily, doctors had a drug for, a therapy targeted to that specific mutation.
The targeted therapy works by directly inhibiting the mutation that's in the cancer cells. The mutation isn't in my cells, it's in the cancer cells, and it stops it from growing, essentially. It doesn't harm any good cells, it doesn't make me feel sick, it only targets the cancer cells. Yeah.
Genetics is the origin of cancer, but it's also our best hope of tackling cancer. I'm Tiffany Boughtwood. I run the national genomic research collaborative called Australian Genomics. The level of understanding of the public of genetics and genomics is increasing, and that's actually why I chose the prop. I stole this from my 10-year-old son. It's his book, The Big Book of Genes.
Cancer, as Tiffany describes it, is a mistake in a cell's genetic code, a mistake that turns into uncontrolled growth.
But I guess from the scientific perspective, the upside of the fact that cancer is a genetic disease is that we can use that to work out where a cancer arose in the body, look for signatures that tell us how this cancer might behave, and show us vulnerabilities in terms of what treatments the cancer might be vulnerable to or responsive to.
And a successful treatment is one that targets those vulnerabilities, turning off the cancer's growth.
By using drugs that are specifically designed to target the changes in the genetic code that are unique to each person's cancer, we are finding that we can cause responses where we've never seen them before, offering options to patients that have never had them before. And that's what's meant by precision medicine or personalised medicine.
Professor David Thomas specialises in studying cancer's genetic codes and matching certain mutations to certain treatments. So how effective are these targeted or precision therapies?
That approach of using science to drive how we treat patients has resulted in a roughly 6-fold increased probability of getting benefits to patients compared to the way that we've used to do things in the past. Precision medicine is really transforming the way that we treat cancer patients.
It's also transforming the way patients feel, with often far fewer side effects than traditional treatments.
Compared to chemo and radiation, it has very little impacts on my life. I don't have to go to hospital, I don't have to have a drip in my arm, I don't have to go and visit a specialist clinic or anything like that, so it's really easy to take. But it also has very reduced side effects. Although at the beginning there was a bit of toxicity, once I got through that toxicity, it's allowed me to have just a fantastic quality of life. I can do everything that I do normally, a little bit reduced in capacity, but I go swimming still, I jog slowly, I ride my bike still. I enjoy doing all those things. You know, they let me feel alive and I forget about my cancer for a bit.
It also means that in the future, cancer won't be defined by where in the body it began. Instead, it will be defined by its particular genetic mutation.
So one drug can treat multiple cancers. So one drug could potentially treat a breast cancer, lung cancer, a prostate cancer, if they all share a particular marker that drug targets. And that creates also a challenge for our healthcare system because we're not used to looking and approving multiple diseases for one particular therapy at a time. These things take time, and a lot of the patients that we deal with every day, they don't have time.
Knowing this, science is striving to develop more drugs to stop more mutations in their tracks. Where does Australia stand in this endeavour?
It's a difficult question to ask where Australia stands in respect of precision medicine internationally. Certainly, countries like the US and in Europe, there are many programs which are significantly advanced on where Australia is today. But I think we're catching up.
We haven't seen the investment in Australia that we've seen in England, for example. NHS England is now offering genomic testing to all patients coming through their clinics. The genomic cancer medicine program there is extraordinarily comprehensive, but it's a massive investment and it's a system-wide change. I think we need to see in Australia a concerted, dedicated investment at a jurisdictional and a federal level in order to deliver such a change.
Both agree that to make change happen, better collaboration among stakeholders is needed.
Such a collaboration needs to involve policymakers, health economists, implementation scientists, so we know the barriers and enablers to see practice changing for the benefits of patients.
The potential to redesign the ecosystem for all the major stakeholders, the people, doctors, governments, and the private sector that develops drugs and drives our economy, is immense. And that's simply by being more creative about the way in which we bring those stakeholders together in a constructive, collaborative, mutually productive way, rather than the way we've done it to this point, which has been largely, I would say, accidental, and even worse than accidental, adversarial.
Emma Capell never thought she'd end up discovering her treatment through Facebook and not her doctor. She says if she'd had the doctor-recommended radiation, she'd be forever looking over her shoulder, fearful of the cancer's return.
For now, we're all just having to help each other in the absence of a greater team that are doing it for you. It's patients helping patients.
Yet when she mentions overseas travel for proton beam therapy, some knock back the advice.
I'm surprised how many people aren't fighting for their lives, not doing the best thing. One chap said, well, I'm in my 70s now. How much longer have I got to live anyway? It's really too inconvenient. I trust my doctor. I'll just go with what he says and have the normal radiation. I'm sure it'll be fine. To, oh no, that's too inconvenient. I've got work, I've got a family, I've got young children, or the expense, the disruption.
Emma says once proton is available in Australia, those arguments won't stack up.
You wouldn't have the worry of funding to get there, of disrupting your family, on top of the fear you already have. It would change everything.
I just felt really amazed and blown away that some researchers have put so much work and effort into finding and discovering these mutations and finding medications that work. It has made a difference to my life, and such a significant difference to my life, and not just me, but I know a whole lot of other people who have the same thing as me, who also would like to say thank you from the bottom of our hearts for the work that they do.
The experts are unanimous. By 2030, genetic sequencing of patients' cancers must become the standard of care.
If they have the potential to have their cancer sequenced, there's a possibility they could find a marker and then match that with a treatment. And that then gives them hope of survival. So we have seen a 90% survival rate in some common cancers. But if you read Vision 2030 report, you'll see that most common cancers are becoming rare through genomic sequencing. And therefore the aim is that all cancers, no matter how rare they are, will be able to have a 90% survival rate.
90% survival? Yes, and beyond, says Professor Thomas.
I don't believe any patient should go to their grave with cancer in 2030 who has not access to that technology.
So there you have it. A new era of personalised cancer treatment is at our doorstep, eager to be let in. All we have to do is open that door. In the next episode, though, we look at more than just opening the door. We tempt personalised treatment inside by showing how harnessing artificial intelligence and big data processing can uncover cancer solutions beyond our human capabilities. So see you in episode 2.